Hello guys, Dr. Price here. I want to make an acute cervical exercise routine for you. Those you have pain, just have an acute injury, you've been in a car wreck, things like that, this video is for you. So the very first thing is make sure you're sitting or standing and lengthen your spine. And I mean from your belly area, lengthen your spine area there. And then lengthen the neck like someone has a string pulling you up like this, right? And make sure your neck is tall. The very first thing you want to do when you get up in the morning, maybe just do this while you're getting up to the bed, is turn your head as far to one side as you can. Hold it for 5 seconds and then back to center. Same thing here. Turn your head all the way as far as you can. Now, notice mine doesn't go as far this way. So don't force it. Just go as far as it allows it, 5 seconds, and back to center. And so as you turn each way, you notice each time that you should really go a little bit further. Rotation is always first. And do this over and over until you notice you start looking like an owl, turning your chin all the way to that shoulder as such. That way, if we didn't have these cameras in our cars, we could look around behind us, turn your neck like in the old days when you didn't have these cameras, and look behind you, right? You don't want to get where your neck's so stiff it doesn't move anymore. So that's rotation. Next one is lateral flexion. Just take your ear, bring it to the shoulder, and don't lift the shoulder. And back. There, lengthen. Everything should be nice and tall. And over to the side. You're always going to have one side that is a little more flexible. Notice this side. I don't go as much this much here, right? I'm not forcing it, just where it goes tight and it locks. I'm going back, and then this side. Notice much more flexibility here, right? So there's your first two. Next one is tuck in your chin. Give yourself a nice little double chin look here, right? And then lock it. And then roll your neck back. Hold that for 5 seconds. See? Don't just do this and do this. That's not it at all, right? I want you to drop your chin and go translation-wise back to it locks in the back, right? And then roll bone by bone, roll that neck back and hold it for a nice 5 seconds. Start the chin and roll, just like that, guys. This is good because a lot of us are watching movies at nighttime before you go to bed, maybe on a computer all day like this. And so you have that flexion in your neck. Your neck needs a curve. It needs to have a nice curve at your C5, C6. You start losing your curve here, you're going to lose it in your lumbar next. So those are your first three. Number 4, okay? Just take your neck and roll it around. It may crunch, pop, crunch, crunch, hear all kind of noises. It's perfectly fine. You're going to be safe doing this. Roll it around, right? That's number 4. And number 5, your traps. Think of these like the muscle's so tight, it's got a spasm, and it's like a sponge or squeezing the fluids out. So the stale blood gets in a spasm, right? So when you squeeze these, hold it for a couple of seconds and then relax. You're squeezing the stale blood out, letting fresh blood in. So you get oxygenated tissue, repair of the tissues, right? Squeeze and then relax. The magic number is 20 times. So you can be sitting in a traffic light in a car and doing this in traffic. Yeah. Don't turn your head when you're doing it. Traps up and let it go. And then you'll start to feel this warm release happening as the traps go down. So 20 times. If you want to roll it back later, that's fine. People like to roll back like this. That's good. But in the beginning, I just want a person who's injured their neck or got soreness, got pain, just to bring the trap straight up and straight down. That's it. So for acute neck pain, guys, something very stiff, something that's injured, those are your 5 movements to start with. Take care. I'm Dr. Price.